This is Jacqueline doing our assessment. Prior to doing an assessment with Jen, I also did an extensive history and I made sure that she emptied her bladder prior to lying down. On the physical piece, I did see some slight scars below the pubic area where she had a laparoscopic surgery done when she was only 10. She'd had her ovary removed, so that was noted, but not noted on the video. So as a precursor, I just wanted to let you know that she had her empty her bladder and her belly was nice and soft. I didn't need her to lift her legs, but that's the components that I wanted to address. And thank you.
This is Jacqueline Gessick, and I'm doing a gastrointestinal and a genitourinary system assessment in two components. So first, this is Jen. Hi, Jen.
Hi.
I'm going to be assessing just overall for any symmetry or asymmetry, any bulging at the umbilicus. I don't notice anything. Everything is a smooth skin tone, warmth, no abnormalities visually. And this, I'm going to look at the abdomen for skin color, surface characteristics, and then I'm going to auscultate the bowel sounds in the 4 quadrants. Bowel sounds are normal, they're active, no hypo or hyper. Next I'm going to auscultate for bruit with the bell over the aortic, renal, iliac, and femoral arteries. No bruits are present. Next I'm going to percuss just generally for the just for tone. I'm going to percuss the liver, 6 to 12 centimeters at the mid-clavicular and 4 to 6 at the mid-sternum. There. Then I'm going to palpate gently for muscle tone and for any surface characteristics of the abdomen. Just going to touch you, Jen. Any tenderness anywhere?
No.
No guarding, no tenderness noted, no masses. Now, so I'm going to palpate a little more deeply using both hands, pressuring. I want to pressure a little bit. And look for the lower liver border, which is a hooking technique. Press and pull at the rib cage. Take a deep breath. And the liver is non-palpable. Next I'm going to palpate the spleen. And it's non-palpable. This would be under the rib cage here. I'm going to percuss the abdomen for tympany. Sometimes you have dull sounds in the lower of the part of the colon where there's and when there's stool present. I don't get any dullness this time. The spleen is usually between the 6th and the 10th rib, so you would count. Like I said, it's non-palpable. So I would percuss the kidney for tenderness. She doesn't execute any tenderness at all. And next I'll be just going over with her the genitourinary system and what to look for. This is Jacqueline and I'm doing a genitourinary examination. I'm just going to explain to Jen how to do her own self-examination. And given family history, we've had family history of breast cancer on both her paternal and her maternal sides, so I would go over how to do a self-examination. It's best to do the examine your breasts 7 to 10 days after your menses. Look in the mirror in 4 positions, leaning forward with your hands on your hips, standing upright with your hands on your hips and behind your head, and laterally with your arm at your side. So you would palpate each breast using the tall Spence, which is standing lying down with your hand over her head. And you would look for heat, for tenderness, for lesions, nodules, any masses, or any thickening, anything abnormal. You would sort of use the faces of a clock to describe the quadrants. In a sitting position, you would also do the axillary palpation and check for any nodules that might be enlarged. You'd also look for any pigment, any coloration changes, any rashes, any lumps or masses, any pain, discomfort that's not normal. Changes in shape, so you would sort of look at yourself naked in front of a mirror and see if there's symmetry or shape is any different or any changes. You would note that as well. Any swelling, any dimpling, any rashes, any nipple discharge, and appearances and symmetry, color, and those things is what we'd be looking for. We do screenings, typically mammograms, and there's some other screenings that we could do too, some other genetic screenings. And so some preventative things that you could do, just at a certain age we would start those. And again, looking for color changes, rash, lesions, hair, swelling, or masses, any changes. And for a male, the testicular exam, stand in front of a mirror after a warm bath or shower. He would inspect the scrotum and the penis for swelling, erythema, lesions. Standing in the mirror after a warm bath or shower, also palpate each testicle between the thumb and the fingers for size, shape, contour, swelling, tenderness, lesions, masses, or thickenings. And also palpate the epididymis posterior to testicle for masses. And a male screening, the age group 2 for PSA screenings would also be recommended for the older gentlemen. So concludes the assessment.